Hello, everybody. A very good evening to you all. Am I audible, everyone? Good evening, everyone. Please let me know. Am I audible? All right. Good evening, Aparna, Pooja, Janvi. Good to see you guys here. Good evening, everyone. All right. So, how are you all? कैसे हैं आप सब लोग? See, this is very tough time that is going on, right? Like we have passed 2 years of pandemic, but then again this season the monsoons have come. So monsoons, they are always a tricky season where we always get sick, isn't it? Kids, adults, हमारे आसपास सब लोग आजकल बीमार हो रहे हैं. कुछ नहीं तो सर्दी खांसी तो हो ही रही है. So how are you all doing? All good from your side, everyone? How is your health? And now this time the exams are coming. Exams are very close, so you have to take care of your health, right? How are you all doing? How is your health, everybody? Are you all fine? Yes, can I have some responses, please? Okay, Aparna, thank you for the response. Okay, Pratik, all good. That's so I'm glad to hear that you guys are doing good. Okay. So, welcome to the session, and today's topic is diseases. Okay, so today we are going to talk about all the different kind of diseases. Okay, human diseases plus inherited diseases. Okay, I'm really glad to hear, guys, that you all are doing good, but today's our topic is about diseases. Okay, so we are going to talk about all the different types of diseases. We are going to talk about what are the pathogens that are causing it. We are going to talk about the causes of it. Okay, and at the same time, and we are going to see some questions as well from the previous year papers which are related to diseases. Okay, so if you go through those you questions, you will see that a lot of questions are asked from here. Okay, the main thing that you have to know is majorly the pathogen that cause the various diseases. Okay, so that is what we will focus on today. So very first question, so if before we go into disease, we should know what is a disease. Yes, would anybody like to answer that? Enlighten me with what is a disease? क्या होता है बीमारी, मतलब क्या होती है? जब भी हम बोलते हैं कि हम बीमार है, उसका मतलब क्या होता है कि कोई एक डिस्कम्फर्ट है, राइट? कोई एक चीज जो हमारी बॉडी सही से नहीं कर पा रही है, उसी को हम बोलते हैं कि हम बीमार है, राइट? So any malfunctioning process that actually interferes with the normal functioning of the body, that is called as dis-ease. Okay, so if you see in terms of English also, dis-ease, so your body is not at ease, right? So it is facing some kind of difficulty, and that is what we call as disease. So disease may be defined as a disorder in the physical, physiological, psychological, or social state of a person cause due to nutritional deficiency, physiological disorder, genetic disorder, pathogen, or any other reason. Okay, so reason of a disease can be a deficiency of a nutrient, so that your body is not functioning properly. It can be a physiological disorder, it can be a genetic disorder. Okay, there is some problem in the gene constituent that you have in our cells. Okay, or it can be an attack to your body by a pathogen. So any malfunctioning process which interferes with the normal functioning of the body is what is called as a disease. So here, if you see this chart, this is a broad classification of different human diseases. So diseases can be it can be broadly classified into two types: congenital diseases and acquired diseases. Okay. Now, congenital diseases means these are the ones which are present from birth. Okay. So this kind of diseases are usually caused by some genetic abnormality or some metabolic disorder or malfunctioning of an organ. Okay, but it is present from birth only. Okay, acquired diseases means it develops after birth. Okay, something that we acquire. So disease that occurs after birth during one's lifetime is called as the acquired diseases. Now, in terms of congenital diseases, the congenital diseases will usually be the genetic disorders, right? So we will talk about the genetic disorders also. So these genetic disorders are the one which will, this genetic disorders, they will come under congenital diseases. Okay. Now, these acquired diseases can further be classified into two groups: communicable diseases and non-communicable diseases. Okay, so communicable diseases means which spreads. Okay, so it spreads from infected person to healthy person. For example, COVID-19, it's a communicable disease, right? It spreads from the infected person to healthy person. So those are called as communicable disease. Non-communicable disease means they cannot spread. Okay, they do not spread from a diseased person to a healthy person. This non-communicable disease can further be classified into five of these classes: degenerative disease, deficiency diseases, allergies, cancer, and other diseases which are caused by various physical agents or any other reason. So degenerative disease is caused by the malfunctioning of some vital body organ. For example, a heart failure. Okay, so it will be a degenerative disease. Nutritional deficiency, the deficiency diseases means it is because of deficiency of some or the other nutrient. Like deficiency of iron will cause anemia. Deficiency of different vitamins cause different kind of diseases, right? So they all will be classified as deficiency diseases. Okay, then there are allergies, which is because of the hypersensitivity of the body to certain foreign substances. Then there's cancer and other diseases. Okay, so we are going to talk about majority of the diseases, but we are not going to talk about allergies or cancers. Okay, because that will be that is a separate topic altogether. Okay, right. So what is the difference between communicable and non-communicable diseases? So if we have to describe it in one word, yeah. So communicable means it can be passed from a infected person to a healthy person. Non-communicable, it cannot be passed. Okay. What are the other major differences? So communicable disease, they are caused by some biological agents or pathogens such as viruses, bacteria, protozoa, and helminths, which in general term we also call them worms. Non-communicable disease, they are caused by some specific factors such as malfunctioning of some vital body organ, or it can also be because of the deficiency of a nutrient. Communicable disease, it spread from one person to another. So how it will spread? It can spread with contact, water, air, and food, etc. Even soil is also there. Okay. Non-communicable disease, it does not spread, okay, from contact. The concern of diseases in communicable involves the society, as these are related to the community health. Okay, so that's like COVID-19, right? So it is it's a highly communicable disease. Okay, so that's why it is related to the community health. The concern of this non-communicable disease is restricted to the individual only, because it is not going to spread from the healthy individual. Sorry, it is not going to spread from the infected individual to the healthy individual. Okay, is it followed so far, everybody? Let's have some BIOs in the chat so that we know you are all good and we can carry on. So during this session, everybody, we will see some various types of diseases. Okay, a large number of diseases we will see, and I have tried to present to them in as crisp manner as possible. Okay, and please stay till the end of the session and fill up the feedback link, and you will get the notes for the session. Okay. All good? Okay, great, Shramalina, Aparna. Thank you so much for your response. Before going ahead, as you all know by now, that BioTecNika's app is available in the App Store, in the Google Play, Google Play, as well as in the App Store, Apple App Store, and you can download it from there. For classes, for webinars, for podcasts, for courses, anything you say, we have it. Okay, in the field of biology. And you can also join our Telegram group for all the latest updates, all the newsletters, and all the latest updates in the biotechnology field. Okay, now moving on with our topic. So, what are the modes of spreading a communicable disease? Okay, so communicable disease can spread by two ways: direct transmission and indirect transmission. So, what is direct transmission? So, direct contact between the infected person and the healthy person. Okay. For example, smallpox, chickenpox, or sexually transmitted diseases like syphilis, gonorrhea. Okay, they all spread from person like infected person to a healthy person by direct contact. Okay. Second mode of transmission can be droplet infection. So what do we mean by this is infected person throws out tiny droplets of mucus by when they cough, when they sneeze, or when they spit. Okay, and these droplets may contain the pathogens. Okay, so a healthy person, if they are inhaling the air containing these droplets, okay, which has the pathogen, the healthy person will also get infected. For example, common cold, TB, pneumonia, and our latest COVID-19 infection, right? So they all are they spread by this droplet infection. Okay. Direct transmission can be in contact with soil also, like soil contaminated with disease causing virus or bacteria. Okay. And direct transmission can also be through animal bites. Okay, for example, the viruses of rabies. Okay, so they are introduced through wounds which are caused by the bite of a rabid animal, like a dog, the dog suffering from the infection of a rabies virus. Okay, so basically the virus is present in the saliva of the rabid animal. So when that rabid dog bites you, so through that open wound from saliva of the rabid animal, the virus comes in our bloodstream and can affect us. Okay, so these are the different ways of direct transmission. Now, what are the different ways of indirect transmission? So basically, by indirect transmission, what we mean is the pathogen reaches the human body through some intermediate agent. Okay, not directly from the infected person to a healthy person, but via some channel. Okay, so indirect transmission can be by vectors such as houseflies, mosquitoes, and cockroaches. For example, like we always say, right, that cover your food and don't let the house flies come and sit on it. Why? Because the house flies, they carry pathogens of cholera on their legs and as well as in the mouth parts from the feces or sputums or if of infected person. Okay, and when they come and sit on your food, so those germs are they are carried and introduced in your food, drinks, okay, from those contaminated places, right? In the same way, mosquitoes, they carry the virus for dengue and even the malaria parasite, okay. Indirect transmission can also be through air, okay, which are called airborne. That is, the pathogen reaches the humans with air and dust. Indirect transmission can be object borne, like transmitted through the use of contaminated articles, so like clothes, utensil, toys, taps, surgical instruments, etc. Okay, although this object borne transmission is quite rare. Then transmission can be waterborne, for example, by contaminated potable water, the drinking water. If it is contaminated, then it can cause major communicable diseases, right? Like cholera, diarrhea, hepatitis, or even or jaundice. Okay. So in fact, in this monsoon, so as I was saying, I was asking you that this is monsoon time. So are you all good? So in monsoon, it is the hub when all these communicable diseases spread. Okay. So waterborne diseases like cholera, diarrhea, and then with the direct transmission like common cold. Okay, so they spread in this season. So we have to be extremely careful and protect us from these diseases. So let's have a discussion on the communicable diseases first. So disease can be categorized into 4 different classes. Diseases caused by viruses like smallpox, measles, polio, rabies, dengue. And then there are diseases which are caused by bacteria like TB or tuberculosis, typhoid, cholera, diphtheria. Then there are diseases caused by protozoa, so like malaria and amoebiasis. And there are diseases caused by worms or the helminths, the round worms, okay, like filariasis and ascariasis. Okay, so we will talk about each of this disease in brief. First, let's talk about the diseases that are called by that are caused by viruses. Okay, so very first disease in this section is smallpox. Okay, so as I was telling you that when I looked up for the questions from this topic, so I found a lot of questions, and majority of them is about the pathogen that causes the disease. Okay, so this is something that you have to remember. So smallpox is a viral disease and it is caused by the virus variola virus. Okay, now the smallpox was one of the most devastating disease which was known to humanity, and it caused millions of death before it was completely eliminated. Okay, so as of now, smallpox is no longer there on earth. Okay, thanks to Dr. Edward Jenner, who made the vaccine. Okay, so the smallpox vaccine created by Edward Jenner in 1796 was the first successful vaccine to be developed. Okay, the incubation time is 7 to 17 days. Now, what do we mean by incubation time? It is the time when the virus is growing in your body, okay, but you are not like the symptoms are still not there. Okay, so during in this variola virus, during the incubation time, you will feel healthy and can't infect others. The transmission, it will be by air. Okay, so droplets from cough, sneeze, etc. And it can also be transmitted by indirect transmission with contaminated items. What are the symptoms of smallpox? Fever, headache, severe fatigue and back pain, vomiting, flat red spots on face, hands and forearm, and trunk that turns into small blisters filled up with pus. Lesions also develop into mucous membrane of nose and mouth and quickly turn into sores that break open. Okay. Next disease that we are going to talk about is measles. Measles is also caused by a virus. The name of the virus is rubeola virus. Mode of transmission by air. Incubation period 3 to 5 days. Symptoms: common cold. Again, appearance of small white patches. will be there. Okay, appearance of rashes in the body, small white patches on mouth and throat. Next, polio. I'm very sure you all might have got the polio drops, like vaccinations. Okay, even vaccination for measles are there. So polio virus is there. So it is caused by the polio virus. Mode of transmission: the virus enters inside the body through food or water. Incubation period of 7 to 14 days. Symptoms: virus multiplies in the intestinal cell and then reaches the brain through blood. It damages brain and nerves and causes infantile paralysis. Stiffness of neck, fever, and loss of head support is one of the common symptoms that happens in polio virus. Next viral disease is rabies, which is also called as hydrophobia. Okay. This rabies is caused by the rabies virus. Mode of transmission is bite of a rabid dog. Incubation period 10 days to 1 to 3 months, depending upon the distance of the bite from the central nervous system, that is the brain or the spinal cord, because ultimately this rabies virus has to infect the central nervous system. Okay, so when a rabid dog bites a healthy person, so this virus transmits from the rabid dog through the saliva and the open wound of the person into the bloodstream. So symptoms are severe headache and high fever, painful contraction of muscles of throats and chest, choking and fear of water leading to death. Next, dengue. Dengue, the pathogen is dengue. Okay, that is the dengue virus. Okay, dengue virus is abbreviated as dengue. And this dengue virus, it is characterized by an onset of sudden high fever, severe headache, pain behind the eyes and in the muscles and joints. Mode of transmission is bite of an infected Aedes aegypti mosquito. Okay, so dengue virus, I think all of you already know, right, that it spreads by the bite of mosquito. But being a biology student, you should also know that what species, what genus, right? So Aedes aegypti is the mosquito species that spreads the dengue virus. There's an incubation period of 4 to 6 days. Okay, so how does this transmission happen? Basically, the transmission of the disease occurs when a mosquito will bite an infected person. Okay, and then from there, it subsequently bites a healthy person. Okay, so the virus transmits from blood containing the virus, okay, to the healthy person, and the person gets infected with dengue. Okay, so from the blood of an infected person to a healthy person via this Aedes aegypti mosquito. Okay, that is how dengue virus will spread. Okay, will be transmitted from infected person to an affected person. And this dengue is caused by the mosquito which bites in the morning. Okay, so this Aedes aegypti mosquito, it bites in the morning. Okay, not at night or in the evening times like all other mosquito species. It bites in the morning. Okay, the symptoms are sudden onset of high fever, generally 104 or 105 degree Fahrenheit, can last for 4 to 5 days. Severe headache, mostly in the forehead. Pains in the joint and muscles. Pain behind the eyes, which worsen the eye movement. Nausea or vomiting. All right. So, yes. So here, so these are all the viral diseases, guys. Next, we will move on to diseases caused by bacteria. So can I have some feedbacks? So moving on, diseases caused by bacteria. Okay. Yes. So the first disease that we are going to discuss here is tuberculosis, which is caused by the bacterium Mycobacterium tuberculosis. The mode of transmission, it is airborne. Okay, so the discharged airborne, so discharged through sputum, cough, or sneeze of the infected person. Okay, and from the air, so the air will carry the droplets, which can be carried on to the healthy person and can infect it. Incubation period is of 2 to 10 weeks, during which the bacteria produces a toxin, tuberculin. Symptoms of tuberculosis: persistent fever and coughing, chest pain, and blood comes out with the sputum, general weakness. Next bacterial disease, typhoid, caused by the bacillus rod-shaped bacterium Salmonella typhi. Mode of transmission, through contaminated food and water. Incubation period 1 to 3 weeks. Symptoms may include continuous fever, headache, slow pulse rate, reddish rashes appear on the belly. In extreme cases, ulcers may rupture and resulting in the death of the patient. Okay, but yes, definitely that are the extreme cases, if in case there is no medical help is provided on time. Next bacterial disease is cholera. So this is caused by the comma shaped bacterium Vibrio cholerae. Mode of transmission, contaminated food and water, and housefly is a major carrier. Okay, so just like I was telling you that these houseflies, when they sit on the feces and the feces of the infected person, okay, or in the dirty places, so from there they take up the this Vibrio cholerae bacteria in the appendages, okay, or in its mouth parts, and when they come and sit on your food, so that the food gets infected. Okay, and when a person eats that contaminated food, the germ goes inside the body and affect them, okay, and causes cholera. So incubation period 6 hours to 2 to 3 days. Acute so cholera will include acute diarrhea and watery stool, muscle cramps, loss of minerals through urine, dehydration leads to death. Okay, so yes, for nowadays cholera doesn't cause death anymore, but yes, there was a time when our medical facilities were not that good. Okay, so when like pre-independence era, when there used to be huge cholera used to happen like an like a epidemic. Okay, so the villages, they used to get wiped out of cholera, okay, because of lack of medical help and hygiene. Next disorder disease, which is bacterial, is diphtheria, which is caused by the pathogen rod-shaped bacterium Cornybacterium diphtheria, and it generally occurs in children of 1 to 5 years of age. Okay, so the newborn children, they get a vaccine for this diphtheria. Okay, incubation period of 2 to 4 days. Symptoms: light fever, sore throat, and general indisposition. Oozing semi-solid material in the throat, which develops into tough membrane. The membrane may cause clogging of air passage, resulting into death. Next, we are moving on to diseases caused by protozoa. Okay, so what is the first disease that comes to your mind? Disease caused by protozoa. Yes, let's have some names. A very common disease which is caused by protozoa. Yes, anyone? Absolutely correct, Pratik. Malaria, right? Yes, Rajeshwari. Malaria is one such disease which is caused by protozoa, right? And whenever we say disease caused by protozoa, malaria should immediately come, right? So malaria is caused by malarial parasite, and this malaria, it's caused by Plasmodium genus. Okay, and in Plasmodium genus there are four species that causes malaria. Okay, so there are different species of Plasmodium which all causes malaria. Yes, Jason, amoebic dysentery is one another example caused by a protozoan protozoa. So this malaria, the mode of transmission, yes, we all know it is through mosquitoes, correct? Yeah. So which mosquito? Anopheles mosquito, the female Anopheles mosquito. Okay. So mode of transmission is by bite of female Anopheles mosquito. Now, this mosquito is not only just a carrier. So Plasmodium, basically, it completes its life cycle. A part of its life cycle, it completes in the mosquito, and the other part in the in the human body. Okay. So Plasmodium completes a part of its life cycle in the salivary gland of the Anopheles. Okay. Where it is present in the gametocyte stage. So two different gametocytes will fuse and it will form the sporozoid. Okay, and it is at this sporozoid phase that it is transferred from the salivary gland of Anopheles to the human blood. Okay, and in human blood, this sporozoid grows into merozoid. Some of the merozoid will again grow in the gametozoid. Okay, gametocyte. So again, if an Anopheles mosquito bites infected individual, so it will take up the gametocyte, okay, and then it will be transferred to to a healthy person. The incubation period approximately 12 days. The symptoms will include headache, nausea, muscular pain, feeling of chillness and shivering, followed by fever that comes normal along with sweating after some time. Patient becomes weak and anemic. If not treated properly, secondary complications may lead to death. The other example of disorder which is caused by protozoa is amoebiasis, which is amoebic dysentery. It is caused by the pathogen Entamoeba histolytica. Okay. The mode of transmission here will be through contaminated food and water. Okay. Symptoms include formation of ulcers in the intestine, feeling of abdominal pain and nausea, and again acute diarrhea and mucus in the stool. Yeah, so this is the malaria. In malaria, this is the life cycle that you can see, right? So in the human body, it finishes its life cycle in the liver of the human body. Okay, so from the liver, again, it forms the gametocyte, and these gametocytes can again be picked up from the blood by another Anopheles mosquito, and that one will transfer it to a healthy person. Okay, next we are going to talk about the diseases caused by worms. Okay, so in worms, basically it will be from the group helminths. So two diseases are there which are usually caused by worms: filariasis and ascariasis. The filariasis is caused by the pathogen filarial worm, that is Wuchereria bancrofti. Okay, the mode of transmission is bite of mosquito, Aedes and Culex. Okay, these are the genuses of the mosquitoes that transmits the filariasis. Okay, or transmits this filarial worm. Symptoms will include fever, collection of endothelial cells and metabolites in the wall of lymph vessels. Swelling takes place in certain parts of the body like legs, breast, and scrotum. Swelling of legs which appear as legs of elephant. Okay, so there is another name for filariasis which is elephantiasis. Okay, so the legs become so much swollen that they look like a leg of an elephant. Okay, that's why filariasis is called as elephantiasis. Ascariasis is another kind of disorder, which is a disease which is caused by worm. The pathogen here is Ascaris Lumbricoidis. Okay, this Ascaris parasite, it lives in the intestine. Okay, so mode of transmission is by soil. So what happens is this parasite lives in the intestine. So this parasite will lay eggs, and these eggs are passed in the poop of the infected people. Okay, so ascariasis is caused by eating those warm eggs. So basically, if there is open defecation, All right. So in that scenario, the from the poops on the poops, there's house flies will go and sit, and from the infected feces, the warm eggs will be picked up by the appendages of the house flies, and then it will be transmitted to the food. Okay, and the food will get contaminated. So whoever eats those contaminated food, they will get this ascariasis. The symptoms include abdominal discomfort or pain. Heavy infection can block the intestine and slow growth in children. Cough due to migration of worms through the body. Okay, so in all these communicable diseases, you see one thing is very common is that if the hygienic conditions are not maintained, then it will spread very fast. Okay, and it will contaminate, and it will spread very fast. All right, so hygienic personal hygiene is very, very important. Okay, so that was all about the communicable diseases, everybody. Now we are moving on to non-communicable diseases. Okay, so non-communicable means it is like it affects an individual at an individual level. It affects a person at an individual level, but it cannot be passed on from an infected person to a healthy person. Okay, so example is that of diabetes mellitus, the first non-communicable disease that we are going to talk about. So causes are less secretion of insulin hormone from the pancreas. Okay. So basically this diabetes mellitus is what we call as diabetes in general terms, right? So it refers to the group of diseases that affect your body, how it uses the blood sugar or glucose. Okay. So diabetes mellitus can be caused by mental stress or through heredity from parents to children. Okay. So even though there is a genetic factor which is involved in the cause of diabetes mellitus, but that genetic factor is not alone. Okay. There are other lifestyle factors, rather environmental factors are also involved in causing this diabetes mellitus. Okay. So diabetes mellitus can be of two types, type 1 and type 2. Okay. This type 1 diabetes mellitus is usually caused by an autoimmune reaction that makes the body to destroy the insulin producing cells of the pancreas. Okay. What are those cells? What is the name of those cells that produce insulin? Quickly, can I have some answer? Yes, guys, let me know that you people are awake and not sleeping. What is that cell in the pancreas that produces insulin? Beta cells, absolutely correct, Jason. So in type 1, what happens is there's an autoimmune reaction that makes the body destroy these beta cells. Okay, so because of that, the body is left with little or no insulin at all. Okay, so it can be caused by genetic susceptibility or environmental factors as well. The other one is type 2 diabetes mellitus, which is the more common diabetes mellitus that we see around us. So the cells become resistant to the action of insulin. Okay, so the beta cells are there, they're producing insulin, but the general cells of the body, they become resistant to the action of insulin. Okay, and the pancreas is unable to make more insulin to overcome that resistance. Okay, so in case of type 2 diabetes mellitus, weight of the person plays a very important role. Okay, the symptoms of diabetes mellitus will be more glucose in the blood, right? In fact, it's also diagnosed by the glucose test. There'll be excessive and frequent passing of urine, feeling thirsty and hungry frequently, reduced healing capacity of injury, general weakness of the body, and in extreme cases, diabetic coma can take place, making the patient unconscious. Now, there's another form of diabetes called as diabetes insipidus. Okay, but the cause of that is very different. Why we call them both as diabetes? Because of the common symptom. Okay, common symptom is extreme thirst and frequent urination. Okay, so polydipsia and polyuria, these are also two symptoms that we saw in diabetes mellitus also, right? Thirsty and frequent urination. All right, but the cause of diabetes insipidus is very different. It is caused by problems with an hormone called as vasopressin, okay, also called as the antidiuretic hormone. So what does this vasopressin do is, it is yes, can anyone tell me which cell of the body releases this vasopressin? Vasopressin is released by which part of the body? Vasopressin, no. Shrivani, it's not kidney. Yes, Jason. So actually, it's not the pituitary gland who makes it. Vasopressin is secreted by the cells of hypothalamus and it is stored in pituitary gland. Okay. So vasopressin is released by the cells of hypothalamus. Okay, everybody make sure of that. It is released by hypothalamus and then it is stored in the pituitary gland. Okay, and later on demand, this vasopressin hormone is released by the pituitary gland in the body when the amount of water in the body becomes low. Okay. So this is caused by problem in vasopressin. So AVP plays a role in regulating the amount of fluid in the body. So if that maintenance is not proper, then it causes diabetes insipidus. Okay, two main symptoms: polydipsia and polyuria. Next, non-communicable disease we are going to talk about is osteoporosis. Okay, so osteo will always refer to bones. So osteoporosis is a disorder where disorder of bones, where the bones become very weak and very fragile. Okay. So you can see here, the healthy bones will look like this, but whereas in case of osteoporosis, the bones look like this. So you can see how much more porous it has become. Okay. And because of this extreme porosity of the bones become very weak and fragile. That means easily breakable. Okay. So the bones, so what happens with the bones is like when we are growing, okay, so bones, they grow with us and they are thickest and strongest in our adult life, okay, until late 20s. But we start losing our bone from around the age of 35. Okay, and this is common, this happens with everybody. But in case a person has osteoporosis, then this losing of bone become even more faster. Okay, then symptoms of osteoporosis are related to location. The various symptoms are there in osteoporosis, and they will all majorly be related to the bone fracture. Okay, so elderly men and women are most susceptible because of hormonal changes which occur with advancing age, and in that also women, okay, elderly women are more susceptible to osteoporosis. Okay, so that majorly happens because of menopause. Okay, so after menopause, because of the hormonal imbalance that, or hormonal change that happens in the body of the women, so they start losing their bones faster. Okay, so that's why around the age of menopause or after menopause, the women are always suggested to take calcium substitutes, okay, or drink milk, right, so that they can maintain a healthy bone weight. Now symptoms will include fractures. Yes, postmenopausal, correct. Fractures of spine can cause severe band-like pain that radiates around from the back to the side of the body. So all the symptoms of osteoporosis that we will see will are related to the location of the fracture. Okay. So there will be repeated spine fractures. Okay, can cause chronic lower back pain as well as curving of the spine, which gives the individual a hunched back appearance. Most patients with osteoporosis develop stress fractures on the feet while walking or stepping off. Hip fractures typically occur as a result of fall. With osteoporosis, hip fractures can occur upon even minor accidents. Okay, and these hip fractures are very difficult to heal. So it may take very long time to heal because of poor bone quality. Okay. Right. So next we are going to talk about the diseases which are caused by nutrient deficiency. Okay. So there are large number of vitamins, and there are large number of diseases which are caused by vitamin deficiencies. Okay. So here I have made a chart or a table that gives you a brief idea about all the diseases and the deficiency of the nutrient, like it is caused by the deficiency of which nutrient. Okay. So there is vitamin A, whose deficiency causes night blindness. I'm sorry. It causes night blindness, increased risk of mortality in children and pregnant women. Folate, that is vitamin B6. Okay, its deficiency causes megaloblastic anemia. Okay, and also can cause neural tube and other birth defects. Okay, because folate is extremely important for the brain development. All right, so that's why like if you have seen somebody who is pregnant around you, so they are always given this substitutes of folate. Okay, because for the growing baby's brain this folate is important. Then there is cobalamin, that is vitamin B12, that also causes megaloblastic anemia, which is associated with Helicobacter pylori. Okay, induced gastric atrophy. So this Helicobacter pylori is a bacteria which is typically associated with gastric ulcers. Okay, so this B12 along with Helicobacter pylori infection causes megaloblastic anemia. Thiamine, that is B1, vitamin B1, causes beriberi, which is cardiac and neurologic. Then vitamin B2, that is riboflavin, causes non-specific fatigue, eye changes, dermatitis, brain dysfunction, impaired iron absorption. Then niacin causes pellagra, B12, okay, sorry, B3. Vitamin B6 causes dermatitis, anemia, plasma homocysteine. Vitamin C causes scurvy, okay, and vitamin D causes ricket and bone related osteoporosis and bone related disorders. Okay, so this was all about communicable and non-communicable disease, everyone. We are next moving on to genetic disorders. Are you guys with me so far? Let's have thumbs ups. Are you all ready to move on to genetic disorders? The inherited disorders? Okay, let's move on then. So, what are genetic disorders? So, genetic disorders, they will occur when a mutation affects your gene or when you have a wrong amount of genetic material. Okay, so it can be a lesser production of or lesser expression of a gene, or it can be a overexpression of a gene as well. Okay, So since it is because of the genes, because of the mutations or changes in the sequence of nucleotide in the gene, so it can be inherited from parents. Okay, it can be passed on from parents to offspring, but at the same time, it can be a acquired mutation also. Okay, the mutation that happens in the individual alone. Okay. This genetic disorders, it causes symptoms at birth, okay, while others develop over time. But majority of the genetic disorders, yes, they can be, they show their effects at the time of birth only. Okay, in the newborns only, the effects can be seen. All right, but still there are certain other genetic disorders which show their effect later as well. So these genetic disorders can be broadly classified into three groups. Chromosomal disorders, that means here the disorder is caused by a change in the chromosome structure or chromosome number. Okay. So this type affects the structures that hold your genes or DNA within each cell, that is the chromosomes. With these conditions, people are missing or have duplicated chromosome material. Then there is complex genetic disorders, which are multifactorial, okay, where genes play a role, but they are not the sole contributor of the disease. Okay, so genes along with the environmental factors, they result in the development of the disorder. Okay, so they are called as complex or multifactorial genetic disorders. So these disorders stem from the combination of gene mutations and other factors. So what are the other factors? It can be chemical exposure, diet, certain medication, tobacco or alcohol use. Then there are monogenic disorders, which are caused by mutations occurring in a single gene. Now, all this, so there are different types of genetic disorders will be there, and these genetic disorders will cause different type of symptoms. Okay, so definitely the severity and the type of symptoms, it will vary from individual to individual and also from one genetic disorder to another. But here there are some of the symptoms or some of the common symptoms that are usually seen in all the genetic disorders. Okay, so it can be behavioral changes or disturbances, breathing problems, cognitive deficits when the brain can't process information as it should, developmental delays like social development challenges with speech or social skills, eating and digestive issues, limb or facial anomalies, movement disorders like muscle stiffness or weakness, neurological issues like seizure or stroke, poor growth, or vision or hearing loss. So here is the list of some of the common genetic disorders. So chromosomal disorders, it can be Down syndrome, Fragile X syndrome, Klinefelter syndrome, Turner syndrome. Multifactorial, it can be arthritis, autism spectrum disorder, cancer in most cases, and also diabetes. Okay, that is diabetes mellitus here. Okay. Monogenic disorder can be cystic fibrosis, Duchin muscular dystrophy, sickle cell disease, or Tay-Sachs disease. So we'll talk about some of these diseases here. Okay. Down syndrome. So Down syndrome is called as trisomy of chromosome number 21. Okay. Trisomy is an aneuploidic condition where chromosome number 21 is present in 3 copies. Okay. So Down syndrome occurs when a baby is born with an extra copy of chromosome number 21. So this is the karyotype of an individual with Down syndrome. So you can see here, all the chromosomes are present in 2 copies, but chromosome number 21 is present in 3 copies. Okay. So people with Down syndrome may have higher chance of some health problems than other people, like higher risk of problems in seeing and hearing, uh, gut or heart defects, hypothyroidism, or problems with their bones. Okay, so people with Down syndrome will have some facial anomalies like this. Okay, where it's more spaced eyes, smaller eyes. Okay, they also will have in general short stature. They also have lower immunity, and everyone with Down syndrome have some or the other degree of learning difficulty. Okay, but still with proper medical help and with proper guidance, people with Down syndrome can still live a very normal life. Next disorder that we are going to talk about is cystic fibrosis. So cystic fibrosis is a monogenic disorder, okay, where the defect happens in a single gene. The gene responsible here is CFTR, okay, cystic fibrosis transmembrane regulator gene. Okay, so this CFTR gene is present on chromosome number 7. Okay, so a mutation that happens in this CFTR gene, because of that the CFTR protein is not present. Okay, and this CFTR protein, what it does, it forms chloride ions in the epithelial cells. Okay, and epithelial cells lining the air passage and the intestine. Okay, so cystic fibrosis, so if there is cystic, if person is suffering from cystic fibrosis, so in them this CFTR protein will not be there. Because of that, the chloride channels will not work properly. Okay, as a result of it, it will secrete very thick and sticky mucus. Okay, now see, what is the function of mucus? The mucus usually is maintained in our air passages and intestine in a very watery and flowy manner, so that if there is any pathogen, it is constantly cleaning our airways. Okay, but when there is this chloride ion channel is not proper, so because of that the mucus become thick and sticky. Okay, then instead of cleaning our passages, it blocks the passage. Okay, so you can see here healthy air passage will look like this, whereas in case of cystic fibrosis it will kind of be blocked with the thick mucus. Okay, so people with cystic fibrosis develop a lot of very thick and sticky mucus in their lungs, airways and digestive system. Almost all men and most women with cystic fibrosis are infertile. Okay, because it also the epithelial cells also lines the duct of the testis. Okay, so it will also block. Okay, this thick mucus will block those narrow capillaries as well, narrow passages as well. Okay, and cystic fibrosis is a recessively inherited disorder, so anybody who is homozygous recessive, they only will be affected with cystic fibrosis. Heterozygotes will be fine. Is it followed, everyone? Next next genetic disorder is Duchenne muscular dystrophy. This muscular dystrophy or DMD is a deliberating genetic condition that causes gradual loss of muscle function that affects everyday movement and activities. Okay, see, cystic fibrosis transmembrane regulator, CFTR, cystic fibrosis transmembrane regulator protein. Okay, it's a transmembrane protein basically that maintains the movement of chloride ions. Cystic fibrosis transmembrane, R for regulator. Right. So this Duchenne muscular dystrophy is a X-linked disorder. Okay. Why? Because the gene, the gene that is responsible here is known as dystrophin. Okay, and the gene that is the protein that is involved here is dystrophin, and the gene coding for dystrophin is present on X chromosome. Okay, so Duchenne muscular dystrophy is a X-linked disorder. So what happens here is, if you see the normal biceps here, okay, so you can see, and this normal calf, so the muscles, they will join properly with the bones, okay. But because in case of Duchenne muscular dystrophy, this dystrophin protein is not present, okay, or it breaks down very easily. So because of that, the connection between the muscle and the bones will be very poor, okay. So the child with Duchenne muscular dystrophy might develop muscle weakness that affects their posture, walking and running, reduced joint movement due to shortening of their muscles, problems with their heart muscle, because heart is also made up of muscle, affecting the heart function, and also difficulty breathing. Next genetic disorder is hemophilia. Hemophilia is also popularly known as bleeder's disease. Why is it called bleeder's disease? Because in hemophilia, if even a small tiny injury can also cause heavy bleeding, okay. See, what happens here is, in case of normal process, okay, so if you are hurt or if you get scratched somewhere, bleeding starts. But immediately, so as soon as there is a rupture in your blood capillaries, okay, so the clotting process will start, okay. So all those clotting the clotting reaction will start, and it will result in the formation of clot, okay, and that clot will stop the further blood release, okay. That happens in normal coagulation. But in case of hemophilia, the blood clotting process is slow, okay. It is like extremely slow. So hemophilia is a X-linked recessively inherited bleeding disorder that slows the blood clotting process. So people with this condition experience prolonged bleeding or oozing following an injury, okay. In some severe cases, hemophilia can also have spontaneous bleeding, okay, without any injury, like bleeding from nose. Spontaneously it can happen. So in case of hemophilia, if there is a rupture in the capillaries, they are not clotted fast enough, and they are clotted, but that clotting takes a lot of time, okay. Why? Because of a mutation that is happening in the X chromosome, okay. So in X chromosome, it will contain the gene coding for the clotting factor 8 and clotting factor 9, okay. So depending on which of the Yes, that's correct, Shivani. It's an X-linked recessive disorder. So, depending on which of the gene for clotting factor has the mutation or which is not working, hemophilia can be of two types. Hemophilia A, which is caused by the mutation in the gene coding for clotting factor 8 that results in lack of clotting factor 8, and hemophilia B, caused by lack of clotting factor 9, okay. Out of that, clotting this hemophilia A is more common. Next genetic disorder, again it's a blood related disorder called as sickle cell anemia or sickle cell disease, okay. This sickle cell disease is a autonomous no, sorry it's a autosomal recessive disorder, okay. And it is inherited red blood cell disorder. So with sickle cell disease, the hemoglobin forms into stiff rods within the red blood cells. This changes the oxygen carrying capacity and the shape of the red blood cells. So what happens in sickle cell disease is that the hemoglobin molecule, okay, if you know, it is made up of two alpha and two beta chains, okay. Now the gene coding for the beta chain contains one transversion based substitution mutation in the sixth codon, and that results in an amino acid change in the beta chain. And because of that, the shape of the hemoglobin changes, and hemoglobin changes to stiff rods, which changes the shape of the red blood cells, okay. And that changes the oxygen carrying capacity. All right. So, and also it changes the shape of the red blood cells. So, red blood cells, which are usually ovoid in shape like this, it becomes sickle shaped. Okay. Now, when the RBCs are ovoid in shape, then they can move very smoothly through the thin capillaries. But when the RBCs become sickle shaped, then they often clot the tiny capillaries, okay, the narrow capillaries. Now, when the capillary is blocked, so what will happen? It will immediately send response to our immune system, and immune system will come to release the block, right? So in that way, it will kill its own RBCs. Okay, and this beta gene is present on chromosome number 11. So mutation is caused in the beta gene, which is found in chromosome number 11. Okay. So, and also the like the normal RBCs, they have a lifespan of 120 days, whereas this sickle cell RBCs only of, sorry, it has a lifespan of only 10 to 20 days. Okay. So क्या होता है कि ये RBCs बहुत जल्दी they die and the body is not able to replenish them. Okay. So signs and symptoms: anemia, episodes of extreme pain, swelling of hands and feet. Okay. And both of these conditions and all of this, actually delayed growth and puberty, vision problem, they majorly are caused because of a cut in the blood supply. Okay. So episodes of extreme pain happens because of lack of blood supply, that happens because of clogging of this narrow vessels because of the RBCs here, so the sickle shaped RBC. Okay. Now, the sickle cell anemia is also a recessively inherited disease. So, whoever is homozygous recessive, they only will show sickle cell anemia. Okay. But the individuals who are heterozygous, they will be normal. Okay. So basically in them, the lack of function of the sickle cell RBCs will be compensated by the regular RBCs. Shrivani, here the change is not glutamine to valine, it is glutamate to valine. Glutamate to valine. Okay, Shrivani, please make the correction. So this sickle cell anemia, if you see, it is also a monogenic disorder. Next, we are going to talk about Turner syndrome. Now, this is a chromosomal disorder. Okay, so where there will be a change in the chromosome number. So Turner syndrome is a chromosomal condition that affects development in the female. So if you see the karyotype of a female with Turner syndrome, so in them, one X chromosome is missing. Okay, so it is called as aneuploidic condition, which is monosomy of X. Okay, which is also shown as X0. All right. The symptom of Turner syndrome is short stature, which becomes evident by age of 5. Early loss of ovarian function. Okay, so basically what happens here is ovaries, they develop normally at first, but egg cells die prematurely. Okay, and but most of the ovary tissues, they will degenerate before birth. Okay, that's why it results into loss of ovarian function. Many affected girls do not undergo puberty unless they receive hormone therapy, and most are unable to conceive. All right. So this was all about the diseases, guys. So I tried to take all the popular diseases, okay, and all the things that can be asked in the question. Okay, and we talked about communicable diseases, non-communicable diseases, as well as genetic disorders. So are you all ready to see some questions now? And again, everyone, please stay till the end of the session and please fill up the feedback form and you will receive the notes for the session. That will definitely help in your exam preparation. Okay. So first question, which of the following is a causal agent of swine flu? So even though we have not discussed swine flu, but I'm very sure you all are aware of it. What is the agent that causes swine flu? So first thing you should remember, swine flu is caused by a virus. Which virus is it? H1N1 virus, right? Okay. Then rickets we talked about. It's a disorder which is caused by deficiency of vitamin D. Then malaria. Malaria is caused by a protozoa, right? And which protozoa it is? Plasmodium. Beriberi, again a deficiency disease, which is caused by the deficiency of vitamin B1. Or if it is B written, if it is B1 written, if it is thiamine written. Okay. So they all are different forms in which the question can be asked. The same question. Next, which of the following diseases is mainly caused by the deficiency of enzyme glucose 6 phosphatase? Now, this is something that we did not discuss in the class. Yes. So, can anyone tell me what is the function of this enzyme, glucose 6 phosphatase? So, this glucose 6 phosphatase, okay, it regulates the release of simple sugar glucose from glycogen that is stored in our liver. Okay, so from glycogen to glucose, okay, so when the release has to be there, that is regulated by glucose 6 phosphatase. Okay, so when there is deficiency of this enzyme glucose 6 phosphatase, then what happens? The glycogen will not be properly broken down in by the body, right? And all of this enzyme, all of these diseases, if you see, okay, Cory's disease, Pompe's disease, myocardial disease, and von Garke's disease, okay, they are all at some point or the other is related to the glycogen storage or glycogen breakdown. Okay, but the disease which is actually caused by deficiency of this enzyme glucose 6 phosphatase is von Garke's disease. Okay. Next question, which microorganism has been associated with appearance of ulcers? So when it is talking about microorganism, all right, so bacteria, so it is answer will be Helicobacter pylori. Okay, but if you remember this the amoebiasis, okay, so that in that also there is ulcer formation. Correct. So both like depending on what option you are getting in the question, you have to give the answer. Okay, Helicobacter pylori is also one of the bacteria, okay, which is associated with gastric and peptic ulcer, okay, which actually causes burning and acute stomach pains. Next question, tetanus, about tetanus. Okay, tetanus is caused by infection of Clostridium tetani. Which is the most common portal entry of this bacteria to human being? GI tract, respiratory tract, nasal tract, none of these choices. So basically here, I yes, I think all of you know about tetanus, right? Like whenever we get a cut, right? So the doctor always asks like, where you cut by steel, where there were rust on that, right? Because then there is a chance of getting this Clostridium tetani infection. Okay, so from there only you can relate that in this tetanus, the positive bacterium, it enters the body by breaks in the skin. Okay, so this bacteria invade body and produce toxins that causes painful muscle contractions that results into locking of neck and jaw muscle. Okay, so none of this portal entries are there for Clostridium tetani. It will be through some break or some wound in the skin. Then diabetes insipidus is mainly caused due to the secretion of vasopressin. Okay, so along with that, you should remember that vasopressin is released by the hypothalamus and is stored in the pituitary, and it maintains the water content in the body. Smallpox, a fatal disease, is caused by which of the following virus? Cytomegalovirus, varicella virus, human HPV, none of these options. So here again, answer will be none of this, because smallpox is caused by variola virus. Okay, but chickenpox is caused by varicella virus. So varicella virus causes chickenpox. In which of the following diseases, next question, in which of the following diseases a mosquito can pick up the infection from one human and transmit the infection to another? Malaria, Japanese encephalitis, and filariasis. So if you remember, we have already talked about malaria and filariasis. In both of them, it is caused, or the mode of transmission is through mosquito bite, right? So for sure, 1 and 3 will be there. Okay. And in Japanese encephalitis also, okay, so this Japanese encephalitis, it's a viral brain infection which is also transmitted by mosquito. Okay, so malaria is a protozoa disease. Okay, disease caused by a protozoan. Japanese encephalitis, it's a disease caused by a virus. Filariasis is a disease caused by a worm. But what is common in them? That they all are transmitted from one human to another via a mosquito. Okay, so answer will be 1, 2, and 3. Now, Turner syndrome is an example of aneuploidy. Okay, because it is X0. So one chromosome is missing. Aneuploidy chromosomal mutation, where it is 2n minus 1. Okay, to be more specific, it is monosomy. Next, in case of X-linked recessive genetic trait, the trait does not get inherited. The daughter of the affected father should be affected. The son of the affected mother should be affected, and only 50% son of affected mother should be affected. So if the trait is X-linked recessive, in that scenario, the sons of the affected mother should be affected. Why? Because what happens if mother is affected? Okay, so let's say that small x is the positive allele. Okay, so positive allele is the small x. Okay, so if mother is affected, means she is homozygous recessive, so small x, small x. Father, we don't know. Okay, I'll just leave a x dash. Now what happens in case of sons? Sons, they will receive Y chromosome from their father, but they will receive the X chromosome only from their mother. Now mother don't have any other option. Mother has to give a small X chromosome. So sons will get one small X chromosome from their mother and Y chromosome from their father. Now since the sons, they have only one X chromosome, so whatever is the allele on that X chromosome, that will be expressed. Okay, so if the disease is caused by the recessive trait, so recessive trait is present in the son and they will show the disorder. Okay, so if mother is affected, all sons, okay, will be affected. So answer will be option C. All right, so with this we come to the end of this session, everyone. Thank you everybody for joining. Thank you everyone, and please fill up the feedback form and you will get the notes of this session. Again, you can download our BioTecNika app from Google Play and App Store. Okay, and please join our Telegram group. Thank you everybody, and bye. Good night everyone. It was nice talking to you all, and I'm very sure this session was informative for you and that will help you in your exam preparation. Thank you everyone. Bye. Good night.